Hi guys, today we're going to be taking a look at regional terms. Regional terms are just the fancy scientific names for different parts of your body. Doctors don't usually say, oh, let's take a look at your big toe, let's see how your armpit's doing, anything like that. They like to use their fancy scientific terms. Most scientific terms do come from Latin. I was fortunate enough to take Latin in high school for 4 years, so a lot of these words I can figure out based on their Latin roots. So you're going to hear a lot of words that just sound like a foreign language to you, and pretty much it is because all these words are based off of Latin. So we're going to go through and take a look at this little guy here. Sorry, I couldn't find one with swim shorts on or anything, so we'll just have to pretend. So we're going to start out on his ventral side. Remember, ventral means belly side. And so we're going to take a look. You can see the divisions in here. They're white. It's not that great, but you've got this picture in your book. You may want to pull out that picture in the book and just take a look at that as well to follow along. Okay, some of these aren't too bad. Like the first one, your nose. Doctor doesn't call it, let me take a look inside of your nose. He'll probably say, let me see inside of your nasal cavity. So nasal. That one you probably know. Nasal refers to nose. Your mouth refers to oral. And just think about, if you were to give an oral presentation or an oral test, that would refer to you talking. And so that's easy to remember because oral has to do with your mouth, which talks. Okay, cervical. This one right here. The cervical, cervix, refers to your neck. And so this region right here, where you have 6 little vertebrae in the back, is called the cervical region. So I don't know if you've ever gotten in a car accident or anything like that, and they put what's called a C-spine on you. That's that thing that looks like a big donut around your neck, like that. And they do that to make sure that if any injury happened to your neck, that it won't get any worse. So they call it a C-spine because it stands for cervical spine. This thing protects your cervical spine. All right, acromial. Acromial refers to the point in your shoulder. If you put your fingers along your collarbone here, it ends in a little bump. That is acromial. That little bump itself is called the acromial process. So it's just the kind of the tip of your shoulder where it joins up with the rest of the deltoids here. So acromial, shoulder. Axillary, that is your armpit. So if there's something wrong, you got a rash in your armpit, ooh, gross. But if we say you have an axillary rash, well, now it doesn't sound so bad. So axillary refers to armpit. Abdominal, you probably know that one because your abs are right in there, nice little ab muscles. So abdominal refers to just this belly region right here. Brachial refers to your arm. And so notice it's the upper portion of the arm right here. So anything brachial, if you have a brachial injury, that means you have hurt your arm. Antecubital. The word ante means before. So like AM, when you're talking time, the A stands for ante, M stands for meridian. So this just means before we hit the meridian, so it's before noon. So ante, and then throw the word cubital on it. The cubital refers to your elbow, so antecubital means before the elbow. So if here's your arm, here's your little pointy elbow, this little area is before your elbow. So that's where it gets the name from. So antecubital is before the elbow or front of the elbow. Antebrachial, so there's an ante again, before. If brachial is the arm, then in front of or behind the not behind, but beyond the arm. So the antebrachial is this region right here, which is typically where they usually draw blood from or insert IVs. So that is your antebrachial. Pelvic region is pretty self-explanatory. So it's the cradle that holds the pelvic organs, which would be like your bladder, girls, ovaries, and uterus. Guys, you do have some tubage, vas deferens and such that goes in here around your bladder, your prostate gland. So the pelvic region is kind of important because it holds a lot of important things. Carpal refers to your wrist. If you've heard of someone or know someone who has carpal tunnel syndrome, that is, they have pain in this little tunnel system of ligaments and nerves and tissues that get inflamed and make it very difficult for your hand to write and to function properly. So that is carpal. Then we have your pollex. It's just a fancy name for your thumb. Palmar is the palm region of your hand, so that one should be pretty simple. Digital refers to your digits or your fingers, and that also refers to your digits on your toes as well, digital. Pubic region, the genital region for males, would include the exterior testicular sac and penis, and then for the females would include the vestibule, the outer opening of the vagina, and the labia. Then we have patellar. It's called that because that's where your patella is, your kneecap. So patellar is your kneecap region out front. Crural, C-R-U-R-A-L, crural refers to your leg. I don't know the root of that one, where that one actually came from, because you don't have a crural bone in there, so I'm not exactly sure. I'll have to find that for you. Then we have pedal, which refers to foot, and just think of if you go to a podiatrist, who are you seeing but a pod or a ped doctor, so that's a foot doctor. So a pedal injury or pedal examination would refer to your whole entire foot. Now your foot is split into two regions, digital like we mentioned before, and your ankle region, which is called the tarsal region, because you have a tarsal bone. That is the big bone that sticks out on the side that doesn't have a whole lot of meat cover in it, so it hurts if you whack it. Over on this side, we've got frontal, which refers to your forehead. Orbital refers to the orbit that holds your eye socket, and so your eye included inside of there. Buccal refers to your cheek. So this right here, that's your buccal region. Mental refers to your chin. So it's kind of funny if you say someone's, you're mental, well, you're just calling them a chin. Let's see, sternal. That one makes sense because your sternum is here. So it's in the breastbone area. Thoracic would be your chesty area. That's also called your thorax. And so your lungs and diaphragm and heart are in that region. Then we have mammary, which on guys just include pretty much the nipples, although men can grow mammary tissue and have what's called gynecomastia, which is a man boobs. Yeah, that's pretty much what they are. And they can get them surgically removed because it is considered a disease of some sort. And it's not just an overweight issue, it's actual mammary tissue. So females, mammary region, a little bit bigger. Umbilicus or umbilical region is anything around your belly button. Coxal refers to your hip, that outer area of your hip. Inguinal is kind of like right here and right here. Guys tend to strain this area more often than girls do. Girls feel this area when they're pregnant. There's ligaments in there that help to hold the baby up, and they get pulled on a lot when you're pregnant. And so that's when girls feel their inguinal region. Sometimes you'll also have hernias, which is part of your intestine that kind of pop out. There's a little hole inside, and your intestines will pop out, and you have to push them back in with your finger. So they'll sew that up so that doesn't happen. We have femoral, which makes sense because you got the big bone right here, your femur. It's that big bone. So femoral region would be your thigh. Fibular or peroneal, not to be confused with hold on, I'm going to get it wrong. Hold on. Perianal. Yeah, that one. Because peri means around, anal means your anus. So peroneal, not perianal, two totally different regions. So peroneal refers to the side of the leg, or fibular. I would go with fibular. It's easier because that's where your fibia is. You have your tibia in front and your fibia on this, fibula. I always get those backwards. Fibula on the side. So fibular. And then remember we have your pollex is your big toe. Your hallux is, I said that wrong. Your pollex is your big thumb. Your hallux is your big toe. So lots of weird names. Okay, let's take a look at your dorsal region. Dorsal. Okay, anything referring to your head is your cephalic region because your head's fancy name is a cephalon. So remember in biology we talked about cephalization, how much of a head you have. That's all based off of the word cephalon. We have your upper extremity, which includes the whole entire arm, and your lower extremity, which would include your whole entire leg. We have your hand all together is called your manus. So if you're, dang it, I can't remember the word. If you manipulate something, you use your manus. Manipulate, manus. So it refers to your hand. Okay, otic is your ear. So this is your otic region. Occipital refers to a bone that you have back here. So the back of the head or the base of the skull is the occipital region. This is where your vision center is. So if you get damage to this portion of your brain, it will affect your vision. I have a story about that. I'll tell you later. Acromial, there it is again, the little point in the shoulder. Vertebral refers to anything along the vertebra. Scapular is your scapula, so around the back of the arm there. Brachial was on the other side, that's your upper arm. Dorsum or dorsal, that's your whole entire back. So that was kind of on the other section there. Olecranal, what a fun name. So O-L-E-C-R-A-N-A-A-L, olecranal. Where'd that come from? That just means the back of the elbow. That is also where your weenus is. Yes, I have to show you this. Hold on. Okay, so this skin right here is called your weenus. W-E-N-E-I-S, I believe. This area of your arm, you can squeeze and pinch really, really hard. It doesn't hurt because there's not a whole lot of nerves there because of all the times you smack it. All right, so that would be your olecranal region is where your weenus is. Lumbar is this area right here and right here. Basically, that's where your kidneys are. If you do a lot of motorcycle riding, that would be where you put your hip guards. What is that? It's anything to protect your kidneys. Okay, the next one, we've got sacral. Now you've got your sacrum, which is this part of your hip bone. There's your hip, and then you have this little thing, it's got little holes in it. That's your sacrum. So anything in this region would be your sacral region. And you have a little bitty coccyx right there. C-O-C-C-Y-X. Your coccyx is your tailbone, although it looks like an elephant. It hurts when you break your tailbone. Usually you don't even know you have one until you break one. Okay, next one, we have gluteal. You know, your gluteus maximus. So gluteal refers to your butt cheek region. There it is, perineal. I'm sorry. I spelled it perianal. It's perineal. Sorry about that. So your perineal, not peroneal. Your perineal region, that is the area here between the anus and the external genitalia. On males, that would be the area between the anus and the scrotum. On females, it would be between the anus and the opening of the vagina. Then we have femoral again from the back. Remember, that's where your femur is. Then we've got popliteal. I like that name. Right here, it's the back of the knee. Popliteal, just a fun word. And then we have sural, is the calf region. Bikers and long distance marathoners have really good sural regions. And then we have calcaneal, which is the heel. That's because that's where your calcaneus muscle is. And then plantar, which would be the bottom of your foot or where the arch of your foot is called plantar. So what we're going to be doing with this one is I'm going to give you a whole bunch of sticky notes. And we're going to write all these things on it, and you're going to pick one person from your group to be the guinea pig. And with the exception of some, like the perineal area, we don't need to label that, and the mammary and the groin area, we don't need to label those. You guys are going to sticky note your partners and try to cover them up and down with all of these terms. So practice these, because you're not going to be able to use your book or your notes in order to do it. You're going to have to go off of memory. So try to practice these words, and then we will stickify someone with all the names tomorrow. All right? So good luck. See you tomorrow.